Good morning and thank you very much for joining us. I am Yori Folare. First of all, apologies for coming to you behind schedule today, but we are here now. Indeed, we apologize once more. My guest this morning is Dr. Japhet Olugbogi, Medical Officer of Health for Apapa Iganmu Local Council Development Area and Chair of the Committee on Covid-19 for the Nigerian Medical Association Lagos State Branch. Good morning, Dr. Olugbogi.
Good morning.
And thank you very much for making time for us.
Thank you for giving us the platform.
Well, you know, just about everybody hopefully has heard that we are in what is beginning to look like the third phase of COVID-19. And then compounding that is the fact that they're telling us that it still is COVID-19, but because it's a different variant, things, you know, the emergency has sort of heightened a bit. Okay, those are unfortunate figures. Let me just run some things off you. Now, according to the NCDC, Nigerian Center for Disease Control, Lagos is still leading in terms of number of cases. Last week, you know, they recorded 286 cases in Lagos, bringing the total up to, cumulative total up to 59,802. Now, we're looking for some ray of sunshine in there. So we can say that NCDC tells us that recoveries, 58,000. Deaths, unfortunately, 456 since all of this began in Lagos State. Now, there's one figure here, active cases, 831 according to NCDC. So what are active cases?
Well, thank you very much again for giving us the platform to always communicate risk to the people at home. Active cases are those who have tested positive. Some of them may be in the isolation centers, and some of them may be in the community. Don't forget that there are some people who we are managing in the way we call home-based care.
Okay.
So these are the active cases. Those who test positive, who are actually positive at that particular point in time, are active cases.
You know, and so if any Nigerian, as you know, there is a certain attitude towards COVID-19 and the advisories that we get from professionals. People just, you know, are not too enthusiastic to embrace it as effectively as the officials would want. In fact, the spokesperson for University of Lagos, yesterday I was reading her statement, and she, among other things, she said, well, because of the known penchant for students not to want to comply with all of those, they had no choice but to say, okay, please vacate these hostels, and as of today around 12 noon, no student is expected to be in the University of Lagos hostels. And everything will now go back to what is that thing?
Online classes.
Online classes and that kind of a thing. That attitude that I was telling you about, that you know better than me, in fact, being a professional yourself, and you guys want us to comply because it's science. You people we're frustrated by saying it's science, and people are saying they're disputing it. This variant, does it matter that there is this Delta variant, or is COVID enough of a challenge for us to grapple that, look, COVID is COVID, whether Delta or the one before Delta, you still have to do everything we tell you in order to take care of yourself. And how well, in your experience as a pro, are we doing in terms of that one that concerns us? Never mind government, never mind getting vaccines, we ourselves.
Well, thank you very much. It's a very, very wonderful question because it's a worrisome affair, like you rightly mentioned. I cannot count how many times we have appeared on TV or on radio to tell people what to do or what not to do. And it's worrisome and saddening that a lot of people still go about their activities with a nonchalant attitude. A lot of people are still skeptical about as to whether the COVID is real or not. Now, like you mentioned, COVID-19 or no COVID-19, Delta variant or not, people need to protect themselves. I think even more so now, people need to protect themselves even more so now because the Delta variant is like an upgrade to the variant we had in Nigeria before. Those who use phones will tell you that you move from one iPhone 1 to 2 to and so whatnot. The more they move up, the more sophisticated they become. COVID-19 is done in that manner. It's presented in that manner. The variant we had before, the A something, this particular Delta variant is even far worse than it. Far worse in the sense that it has mutated in such a way that it can enter into our cells far more easily than in the previous one. And then when it attaches to our cells, it means that it poses more great danger than to the immunity than the previous one. Then it's also possible to be spread than the previous one. Apart from that, what will also interest you is that people who have it may not even show symptoms, may not even show as many symptoms. Those who show symptoms may not show as many symptoms as those for the previous one. Apart from that, it also causes a higher number of deaths and morbidity than the previous one. So right now, it is worrisome if there are people out there who still believe that COVID is not real, if there are people out there who still do not want to take measures to protect themselves. I think the onus lies on all of us to protect ourselves. Forget whatever the government is doing. It is an individual task this time around. Yeah. And I made bold to say that the nonchalant attitude is far worse in the youths, the students, than in the elderly or the middle class, the middle-aged adults and all that. Because we paid some advocacy visits to some schools, the Committee on Infectious Diseases, the Committee on COVID-19. We paid advocacy visits. We paid some sort of monitoring visits to some schools, and the experience was, it left a bitter taste in the mouth. These students, when they see you, they wear their mask, and when you're not there, they do all sorts of things and all that. And then when the government says, don't go to club, don't go, this is the age range of those who actually,
Exactly. And we also have with us Dr. Tuyi Mebawondu, this time remotely. Good morning, Dr. Mebawondu. Thank you for making time for us this morning. Okay then. As a public health expert, I wanted to harp a bit on the attitude of the citizenry in your experience, because we'll come and be talking about all those other scientific ones. But as a public health expert, give me your commentary on, in your environment, and maybe even beyond, if you're studying it, what is the attitude of the public to the alerts that we were getting, first by NCDC, then the Lagos state government also saw fit to put out a warning, and this is in the midst of, if you put it in a global context, I understand the epicenter has shifted now from India to, a country, an Asian country. Just tell me about that. How are we doing in terms of our attitude?
I like myself, I'm sure you are not surprised about our attitudes to public health issues. We have not ingrained public health discourses, public health education into the younger generations. What I mean by younger generations, most of the time, all these habits, wash your hands, start from primary schools and even in kindergarten, where you actually taught the importance of keeping yourself healthy. Those things has not been like that for us. All we do is run our life, nobody gives direction. And even individually and government and community, we're not paying that attention, the necessary attention to simple public health intervention that can save life and make us healthy. So now, we cannot just wake up suddenly and think that we are going to send message to people and then their behavior is going to change. The complexity of behavioral change is not just that when the information goes out, people pick the behavior and pick the information and change their behavior. It's far, far more complex than that. There are there are intersections from when the information goes down and when people change their behavior. There are a lot of intersections. Sometimes we have to actually enhance the behavioral change. You have to incentivize the behavioral change. The people must be able to connect and see the sincerity on the part of the informants, and the people receiving those information. So we lost, for COVID, we lost it at the beginning. When we allow conspiracy theories, when we allow religious leaders, when we allow not scientific postulation to take hold of the information space, and push that rapidly to the extent that right now we don't even know what is true. People don't even know what is true. We just don't even know what they should believe. So then the second thing is that changing behavior or changing attitude is not just for you to say, listen, people can die of COVID, and so what? They say that people also die of a lot of things. We have to put our boots on the ground. We have to be able to, discourage negative behaviors that will endanger the health.
Indeed.
We are not discouraging that. We just say it, and then there's no anybody fighting you, even if you don't wear face mask, even if you don't, wash your hands, even if you gather in a crowd. We'll only see some occasional action or act of the government when they raid a club, they parade those on television. That shouldn't even be the issue. Why are you parading those things on television? It's a way to actually take those people to somewhere and quarantine them for a number of times, and so that the behavior will not be repeated. So that let's face it, our ways of sending those information out, our ways of enhancing and deepening the communication from beginning is faulty. And then to cap it off, there's a huge distrust of the government. People look at the government and wonder what they're saying. When they even see the chief CEO of the state and the chief executive of the country not putting on face mask, not obeying those things they want them to obey. What do you want? What do you expect? It's a complex.
Okay, Dr. Mebawondu. So I guess generally we relaxed a bit. There was a time for a while there when for some time, I'm not sure the president showed that particular example. Do we see the president in masks? Everybody else will wear a mask around the president, but you don't see the president himself wearing a mask. But maybe, but going back to what Tuyi is saying about how examples need to be shown. But okay, I wanted you to put, if you will, the latest figures from NCDC in perspective. In particular, they are saying that last week they recorded 286, and that's a high. In fact, so much so that it brought the governor, apart from NCDC itself putting out a statement, the governor of Lagos put out a statement as well. Could you put the figure of 286 deaths last week in perspective for us? Is that the highest, or just put it in context, or incrementally, how bad is 286 deaths when we're not seeing those figures for other states in the country?
Yes, incrementally, the figure 286 was large because at some point in time we recorded 0 from Lagos, we recorded just 2 from Lagos. So, and that was not too distant ago. We're talking about just less than about 2 weeks ago here. So if within the space of 2 weeks we had 145, we had 98, we had 286, then that is alarming. That is
especially when you look at the closest figure to Lagos. Looking at the NCDC table I have here, well, I won't say the closest, but you see Gombe is having 18 cases in that same period.
Even for Gombe, 18 is a lot. So
okay,
yes,
okay,
it was a lot.
Federal Capital Territory 11. But there's so many states with 0.
There's a question that I would like to ask about that. Are they testing? Are they still testing?
So when states like Abia, Adamawa, Akwa Ibom, all the A's, in fact, all the A's right up to, you exhaust all the A's and then you come on to Edo, is still 0 before Ekiti chips in with 3.
Are they testing?
Are they testing?
I strongly doubt it. If they are testing, they will pick up cases. Now, even in Lagos, if we test as much as we should, I'm sure we're going to get more than the figure that we have. Yes.
So it's a serious matter.
It is a serious matter, actually.
The way data is collected, it depends really on people actually contributing data.
Oh yes, yes.
So data, this is a conservative estimate.
Data is not a one-way thing. It depends on the person who is collecting the data and from the pool you are getting the data from. So if people don't come forward to test, if you don't get samples from people, you only record what you get.
You know, Dr. Mebawondu, one might be tempted to say that, well, even as doctors are saying 286 is a significant figure in terms of the incremental rate, you know, Lagos is what? Something like 20 million, or, you know, would you fault somebody who said that, I mean, 286, you know, 20 million, you know, we shouldn't.
Ogayori, listen, that's what we should do is look at it, the figure from a week. You are seeing what I would call an exponential increase.
Yes.
And then when you look at the virus, by the time you take a sample, okay, of say this number of tests, and you are looking at those figures as they are ticking up, it's a danger. Okay. Now, there's what we call the RO, the replication index of the virus. Okay. When you are seeing the virus, you know, from 0 became 9, from 9 became 100, before it became 286, and you project that forward, it's a trouble. Don't forget, the active cases are still in the community. They are interacting. Okay? Before you know it, that 286 will jump to 286 raised to power 4, raised to power 6. And before you know it, your system is overwhelmed. Now, you won't wait. It's not just a mark of 286 over 20 million. No. Because what you have done is that you've not even tested the 20 million. For you to see that 286, probably, you need to figure out that maybe they've just tested maybe about 1,000 or 2,000. And that's a lot. So, but what is more important is the increase, the gradual increase from last week to this week. And when you compare to the previous week and 3 weeks, 4 weeks ago, you know that there's a danger coming. You shouldn't wait until you get to 10,000 before you know you're in trouble. It's not done that way.
You know, Dr. Olugbogi, yeah, I take what he's saying. But here we have this situation where we've been told what we can do for ourselves. The normal routine, you know, correct social distancing, washing your hands frequently, you know, the whole bag, masking in public and all of that. But there's a situation here where vaccination is probably the most effective protection you can give yourself. And that is the conundrum right there. I hear that our figure is, you know, somewhere around, what, 1%? And we hear that there are countries that have done almost 80%.
88%.
There you go. Which country? Are you talking about the US?
I'm talking about the UK countries.
The UK, okay, UK, yes. Countries in that region.
We have at least 2 or 3 of them that have done 88, so 90%.
Here we are with just 1%. Even now, they are even, I was just listening to foreign news, and they're even now looking at the whole matter about the possibility of mixing different COVID vaccines. That is to say, you might have had one. They say they're still studying that properly to know whether...
No, that's not advisable for now. I mean, people take one and they get pain, they get fever, they get rash, they get all that. And that's because of a reaction to the vaccine. So we shouldn't mix vaccines for now until we are sure that it is safe to do so. What we should do is to get a large number of doses of the AstraZeneca, get a large number of the Johnson & Johnson, like the federal government promised.
Yes.
And then we start vaccinating. In fact, in my opinion, I want to suggest that when we get those vaccines, we shouldn't give some people 2 doses. We should just vaccinate everybody with the available vaccines. Because even 1 dose of the vaccine confers some form of immunity against the virus.
So it's like instead of 1 dose is better than no dose.
1 dose is far, far bigger and effective than no dose at all. So
talking about the vaccines and the availability of it, we have a package. Let's look at the what the horizon is looking like in terms of getting the much needed more vaccines into the country.
23 countries on the African continent are grappling with the effects of a raging 3rd wave made worse by the fast-spreading variants. Nigeria's first case of Delta variant was detected on the 8th of July. Nigeria once again is expecting shipments of vaccines even in the midst of a global shortage.
We have also received communication about the delivery of the following vaccine shipments in the coming weeks. Firstly, 3,924,000 doses of the Oxford AstraZeneca by the end of July or early August 2021 from the COVAX facility. Fourthly, 29,850,000 doses of the Johnson & Johnson COVID-19 vaccine procured by the federal government through the African Union.
I do not wish to sound alarmist when saying that last week, Africa marked the continent most day week of COVID-19 pandemic. But we all know that the worst is yet to come, with the third wave continuing to escalate, and 15 countries now in resurgence.
All 36 states plus the FCT reported that all vaccine were utilized, and we look forward to the remaining 1.4 million receiving their second dose as soon as is possible.
As the country officially ends up the first phase of its COVID-19 vaccination plan, more than 3.9 million eligible Nigerians have been vaccinated, representing 98% of the little over 4 million doses of the vaccine.
The evidence that we have is that the vaccines protect against severe disease, against hospitalization and mortality. However, even with the vaccination, it is possible to have a mild form of the disease, right? And it is still possible for you to transmit the virus.
The agency says it is putting in place all logistics for storage and distribution, as the federal government has also procured 60 units of the U701 ultra-cold chain equipment for deployment across states. With this more than 40 million vaccines coming into Nigeria, its impact will show greatly in boosting the less than 2% rate of Africans that have been fully vaccinated. Kemi Balogun, TVC News, Abuja.
Thanks to Kemi Balogun there. A number of things came out from that package. First of all, as you doctors are advising that, and it was said there again, that look, one of the main things that should attract us to the vaccine is the fact that it will keep you out of hospital. It will keep you from hospitalization.
Yes.
Whatever else it is going to do, you can take that as a large bonus. And the figures that are circulating as to what it takes to be admitted into a care ward.
Oh yes, that's also there.
That's something else.
Yes.
And so experts are saying that this vaccine is going to keep you out of a hospital. However, it was said there that even when you have already got the full dose of the vaccine, that doesn't mean that you can't still have a mild form of it, and that it is transmissible.
Oh yes.
So this is something that people probably don't know, because a lot of people might think that I've got my 2 doses, I'm immune now to COVID-19, but that would be erroneous.
Yes. Well, when you get 2 doses of the vaccines, you are immune to COVID-19.
Mm-hmm. Okay.
At least to the extent that you would not get a bad illness from the virus, even if you do get the virus, because you can still get the virus, and then you are not likely to die.
And if the person still gets the virus in spite of being completely vaccinated,
yes, you can still transmit it to someone else.
You know where it's going.
So that's why.
So people around you are still in danger if, God forbid, you go and have it without knowing that you
spread it to someone who has not taken their vaccine. So people around you are still in danger. But if you are vaccinated with 2 doses, you are in the company of those who have been vaccinated with 2 doses, the chances that you are going to transmit anything is very, very slim. It's the same with other infectious diseases. When you get vaccinated, the chances that you transmit or somebody transmits to you or you transmit to somebody is very slim because of the herd immunity. But as we are in Nigeria, the number of people who have been vaccinated is just a little upward of 1%.
Yes.
They're not up to 2%. Now, if you take that to the market, if you take that to the bank, you cannot use that to collect money anywhere. If you compare that to what the Europeans are doing, what the Americans are doing, we are a far cry from where we should be. We are looking for a target of 60% at least, but we are just about 1% or 1.5%. So it's still a far, far, far cry from where we should be.
Doctor, well, I've got 2 doctors here. The doctor over there, Dr. Tuyi. This is from a public health point of view, this is a big problem. 1% only at the best is what we have. And people talk about we need to get to a level where we have herd immunity. So that is not a conversation we can be having in Nigeria at the moment, getting to this, that milestone of we now have herd immunity.
Yeah, in the history of pandemic, the way the world has used to beat pandemic is through massive vaccination. And then, unfortunately, we don't have the vaccine. That's the unfortunate thing now.
But are you encouraged by the figures we're getting that up to 4 million vaccines are expected in the country? Yes, it's good. It's encouraging. We hope that is the situation. But even at that is still far behind. COVAX system is such that, we warehouse vaccines and distribute to the countries of less means, like Nigeria or developing countries. For now, even COVAX has just about 95 million doses of vaccines for 120-something countries that are actually in need of those vaccines, that don't have money. So we have to, apart from COVAX, we have to look elsewhere to get the vaccines. Donation from the United States. Sweden is trying to donate to some other country. We need to strengthen where can we get those vaccines moved to the country and then deployed. Yes. I listened to the report saying that about 3.7 million people have been vaccinated. No. People just about 2 million maximum, because you have to. But the report contained figures. They contained official figures as issued.
2 doses of the vaccines. The vaccines we got was 3.94 million doses. Okay. Let's get that straight. And then you need about 2 doses. So we are just close to 2 million in the vaccination. So don't let us hype ourselves up unnecessarily. You see, misinformation is dangerous. We cannot just continue like this. Let's state clearly where we are so that we know what we need to do. Okay. Now, what happens is that if we can get those, I had about 20 million doses and another 3.7 million doses of vaccine or so, one from Johnson & Johnson, another one from the COVAX initiative. Now, if you get that one, I can put that one on. Like I said, we should push to get a manufacturing licensing agreement with one of these manufacturers, and then build a factory within a year, and then produce the vaccines and give to our people. The COVID is not going to go away soon.
Okay. Dr. Mebawondu, let me take a viewer now. Good morning, Mazi.
Good morning, sir. Good morning, Dr. Japhet. Good morning, Dr.
Okay.
I want to find out from the 2 doctors that if one walks into a hospital or a clinic, are you going to tell them that you have come to run a test for better guidance, or you will just tell them that what? Because why I'm asking this question is that now, if you look at the issue of this vaccine, the vaccine cannot go around even in 2 years' time or 3 years' time in this country because of our population, because we don't know the actual number we have. Now, before we were told about this ginger, garlic, and ugu and the century and the rest. So what do you think Nigerian president will be doing to do what? To prevent some of these the symptoms.
Okay. All right. Thank you very much, Mazi Okorafor. Okay. Would you like to talk to his question? Because I was going to extend from what we... okay, please go ahead on that.
Well, Mazi, thank you very much for your contribution and your question. If you want to do the test, you're not going to ask for Delta variant test. You're going to do a COVID test. And you can do that at IDH, at NIMA, at Luth, and some other private laboratories. The Lagos State government, I believe, is also trying to reactivate the sampling collection centers at the local government levels. So very soon, I don't know how many days, I don't know how many hours, but you might be able to carry out your test at any of the LGAs very closest to you. So apart from that, we have said over and over again, that when you wear your face mask, when people wear face masks, you reduce the transmission level to barest minimum, almost 0%. So you should wear your face masks, your children, your wife, your family members, your colleagues, your friends.
Even as these masks are not surgical masks, they still are highly effective.
Even if they are not surgical masks, they still confer some form of protection compared to not wearing masks at all.
And even a cloth mask.
Yes, even a cloth mask. I have a cloth mask here.
Those are working
because I've been vaccinated twice, and my colleagues in the hospital have also been vaccinated. So I'm wearing a cloth mask. It's protective.
Ibrahim in Kaduna, good morning, sir.
Good morning, Uncle Yori.
Thank you for calling. Good morning.
Thank you. Good morning, Uncle, and good morning to your guests over there as well.
Thank you.
Good morning. Thank you.
Sandini Ibrahim calling from Kaduna.
Okay, you're welcome.
You see, I would like to contribute in this very topic that you brought up this morning. You see, like this COVID-19, to me, I can see the go up on rate in Lagos. It shows that yes, they are fully determined to do what they're supposed to do. Unlike other states that have never done nothing, I can say virtually nothing. You see, let's look at the steps they took so far by calling on the students to vacate the hostel or the school. It's very, very necessary. It shows that yes, Lagos State are fully in action towards this pandemic. If other states were able to do so, we should try to cover this thing. One thing I would like to know, at least, government, if they are really proactive concerning this ailment, it will come down drastically. Why would I say so? Like, look at our social gathering spaces. Now, we forget all the conditions they gave us. And government did not even try their best. But we as a citizen as well are not even sure that there is something existing like this. What I want government to let us do now is that let government go to all offices, schools, and other social gathering areas so that vaccine each and everybody, every one of us. Like myself, I have never seen. I have tried to locate where am I going to have this, and nothing. The second time is going now. So what is going to happen to us in the future? So we are not doing anything. Government should please be proactive. If you are a worker, let them strategize. Let them set aside some people that will do their own in their own working environment, in the market as well as in school. Thank you very much for hearing my call. It has been Ibrahim again. Bye.
Thank you very much, Mr. Ibrahim from Kaduna. Doctor, we're looking for vaccines. We need to get as many as we can.
We do.
But at the same time, there are people who are also worried about what is referred to as vaccine dumping. What's that concept, and why would people be worried? I thought we wanted everything that we could get. You can't dump a vaccine that hasn't been proved and tested and retested.
Well, I don't think it's a founded fear because of the fact that we have Europeans vaccinating their populace, the Americans all over the world, even in India. UK has licensed about 4 companies. They're using 4 vaccines. The same thing in the US. And we are asking for, some of these vaccines that they may not need. So they dumping vaccines in Nigeria or in Africa, I don't think is a founded fear at all. Now, my own fear, which everybody should be concerned about, is that when the Americans have dealt with COVID, when the Europeans have dealt with COVID, India, Asia, when they've dealt with COVID, when they vaccinated up to 80%, 90% of their population, and COVID is not ravaging them anymore, what happens to Africa?
Exactly.
What will happen to Africa? So COVID might be dumped on our doorsteps if we don't take drastic steps to procure vaccines and then nip this in the bud. Because the whole world ought to be vaccinating at the same time for us to be able to fight a very, very successful fight. Because when particular countries, vaccinate and they reduce the spread of the virus in their country, the other places where people have not been vaccinated, the virus moves there.
Indeed.
Yeah,
Indeed.
the virus moves there. That's why we were saying so many times that we should all be vaccinating at the same time. We should all be, kicking the virus out at the same time.
Dr. Mebawondu, and this is something that I've heard the American president comment on, that look, until everybody is vaccinated, nobody is safe, even if you are vaccinated 99% in your country. And I think I understand the theory behind that idea. But it is what it is in case of Africa. We just heard in the report that all of Africa, maybe 1%. And even locally here, whether you guys have been discussing the figures, whether it was 4 million doses or whether it was 2 million doses. But we still have the challenge of abysmally low. Compounding that with the fact that there are those who are even saying that some vaccines are better than others, and that we're not getting the A grade. For instance, people say that the AstraZeneca one is maybe different from, if they had a choice, they go for the Johnson & Johnson one instead of AstraZeneca. What do you think of all those ideas?
Well, you see, there's always the business side of...
one moment, please, Dr. Mebawondu. Forgive me. I'll come straight back to you. Good morning, Mr. Yakub. I've held you on for a while.
Yeah, Mr. Very good morning, sir. And then Dr. Olugbogi and then Dr. Mebawondu. Good morning to you, sir.
Good morning.
Yeah, I have 2 questions. But before I ask my question, please, just give me a minute, please. Does it mean that Nigerians, we don't have money to purchase this vaccine? And then the government will claim that some money that was siphoned by corrupt elements, they collected those money. What are they using this money for? I think my own opinion, they should use this money to purchase this vaccine.
Okay.
Now, this is my question.
Yeah.
Dr. Olugbogi, does it mean that somebody that's taking AstraZeneca vaccine, and then he went to the place again, they say the vaccine is normal. And then after like 2 months or 3 months, he went there back, and then they said that they have Johnson & Johnson. Can that person take the Johnson & Johnson? What is the advantage or disadvantage? Can they mix it up?
Okay, thank you very much for calling in. Dr. Mebawondu, we will review. Let's go back to you, and then we'll come back to studio.
Now, yes, exactly. I think there's always the business aspect to this vaccine, and such a health intervention. Now, the point is this: you cannot dump vaccine, because what has happened is that what we call the emergency use authorization that affects about 8 vaccines. The WHO approved for emergency use authorization. What that means is that anywhere in the world, those vaccines can be used. Now, the dynamics of politics of vaccination then came in, and the different companies like Pfizer, who was funded by US, as much as $4 billion was given to them by the then Donald Trump to do research on the vaccine, and then you see Moderna also funded by Europe and America. And then you see AstraZeneca being funded by UK and Sweden. So all these companies, they are trying to push their vaccines to have the dominance. And then we now enter the era of what we call vaccine diplomacy, whereby China and Russia were using vaccines to open their influence in some countries, especially in the Eastern Europe, and part of the Persian Gulf. So a lot of interest came in with regard of what vaccine is, how to use the vaccine. But that has never taken away the fact that vaccine is needed and vaccine will work. It hasn't taken that away.
Okay.
At our level
but it's very scarce.
Focus on essentially is that
it's very scarce, unfortunately.
Focus on how to get the vaccine and use the vaccine.
Okay.
And leave the politics and diplomacy of vaccine alone for those countries who are trying to play it.
Okay, one moment, please. I beg your pardon. One moment, please, because I got a guest, a viewer. I beg your pardon. I got a viewer who's been holding on. Good morning, Reverend Dominic. Oh, we lost you. I'm so sorry, Dr. Dominic. Reverend Dominic. I'm in the middle of doctors here. So sometimes they're Reverend, because some reverends are Reverend Doctor. But I just delete the doctor. Reverend Dominic, so sorry. See if you could call in again. He spoke to, we got to in the conversation, this whole matter about one of the problems we have, we don't manufacture any. There was a time they were discussing something interesting. They were trying to get these companies to license some countries, companies in some countries to strictly supervise the local production of vaccines. Is it the business aspect of it that is not enabling this? Because this is an emergency here.
Yes, I think the business aspect of it, the politics of it as well. It's not. I'm not sure we have been able to fine tune it because, like Dr. Mebawondu mentioned, there are so many, things that are at play here when it comes to production of the vaccines and even the vaccines to choose. As a public health physician, I am aware that some vaccines are better than some, but you can't use all those vaccines in every country. Okay. For instance, if in Nigeria we want to choose the best vaccine, then we'll be thinking of how, to store the vaccines, how to utilize what we have stored, storage conditions, cold chain equipment and all that. So we have to put all that into consideration. Now, if we move away from that and move away into maybe the politics of it or diplomacy and all that, we don't have money to purchase, or maybe we have money, maybe we are not using the money to purchase vaccines.
Because
we are waiting.
Yakub brought up a matter of money.
Exactly, that's why I'm mentioning that.
You don't have money.
Maybe we have money, maybe we are not just using the money to purchase the vaccine. So if you are waiting for somebody to give us vaccines, we are only going to take whatever the person decides to give to us, not minding the fact that whichever one we get, we still protect against COVID-19. Now, the issue that we should all concerned about is that if we don't vaccinate as urgently as we need to vaccinate, this virus may become so mutant that we may not be able to use the available vaccines to protect the populace from the mutations.
Mr. Usman in Victoria Island, Lagos here. Good morning.
Lekki, please.
Okay, sorry, Lekki.
Yeah.
Go on, please.
Okay. But I'm watching the TV. Okay, should I be talking?
Yeah, go ahead, please.
Yeah. Okay, thank you. The issue of sending the university students away, I think it's not the solution.
Okay.
Are you hearing me?
Yes, we can hear you. You disagree. You disagree with the Senate of the University of Lagos asking the students to go home.
Exactly. I believe that's not the way we should do it. We are Nigerians. The best way they should do it to provide the vaccine in the school.
Okay.
Hello.
Yeah, we heard you. We're running out of time. We heard you, and I'm sorry to abbreviate your response, but I think that's the essence of it. You don't think the Senate of the University of Lagos got it right, and you think that perhaps it would have been a better idea to go vaccinate all the students in the University of Lagos. Thank you very much for contributing. We hear that idea as well. But they had explained that there are challenges. Students just were not playing ball, so to say, And so, look, before we get a major catastrophe on our hands here, people should please leave the hostels. We're fast running out of time, but Dr. Tuyi, let me come to you so I can come and end up in studio. At this time, then, it is clearly an emergency. Very briefly, please, what would you say to, because just about everybody, you're a public health expert, just as Dr. Olugbogi is, what would you say is the best thing that we could be doing for ourselves?
Now, our situation is this. We don't have vaccines. The Delta variant is here. Okay? It's affecting younger population. It's spreading faster. We don't want to lock down again. If we're not going to do that, the incident commanders, in the presence of the federal state governors and federal government, should do more in terms of communicating and supporting preventive measures, not vaccine preventive measures.
All right.
I will also push that we should go right ahead and create lower level of incident commanders, even at the local government. What role is the local government chairman? What are they playing?
I'm going to have to leave it there, Dr. Mebawondu, but thank you very much.
We can deepen the communication.
Okay, thank you very much, Dr. Mebawondu. A few seconds. Or you really just endorse what?
Yes, I endorse all he has said. In fact, the last part you mentioned, I would like to stress it too. I think the local government chairman should do more. Some of them have been wonderful, but they should do far more than they're doing. And then the individual level, let's protect ourselves. Let's wear our face masks. Let's ensure that we, avoid large gatherings for now. Exactly. Because I think it was because of
that would include parties and religious services and that kind of thing.
And then the government should also ensure that passengers of interest who come into the country from high endemic areas should self-quarantine themselves for at least 7 days.
Well, thank you very much, Dr. Japhet Olugbogi, Medical Officer of Health, Apapa Iganmu LCDA, and Chairman of the Committee on COVID-19 for the Nigerian Medical Association, Lagos branch. And Dr. Tuyi Mebawondu, Public Health Physician and expert, thank you very much as well for making time for us this morning. That's our program. Please join us tomorrow for a fresh edition. I'm Yori Folani. Bye-bye for now.